Hysterectomies. Some people think they're way too frequent. Now medical experts and women alike are struggling to understand why such a major operation continues to be almost routine. With the help of University Hospital's Dr. Ted Castell explains how one mentor woman challenged the routine.
Some women want hysterectomies and they have no problem. They sail right through them without any problems, but I felt it was wrong for me.
Mary discovers she has a benign uterine growth called a fibroid. Already the mother of 2 boys, Mary wanted to have another child. But she was told not by 1, but by 2 doctors to have a hysterectomy. If she had listened to them, little Rosa wouldn't be here today.
After a few days of being depressed, I decided to go to the library and do my own research about hysterectomies, and I discovered that there were other options to treat fibroids, and one of them being a surgical procedure called a myomectomy.
A myomectomy is a surgical procedure where you would remove a fibroid tumor out of the uterus, stitch back together the uterus, and leave the uterus in the best possible condition to either reproduce, have a baby, or simply to go through the normal menstrual process that happens every month.
While there are many reasons why hysterectomies are needed, especially in cases of cancer, there's no simple answer to explain why they are advised so often.
It's easy surgery compared to a myomectomy, and a myomectomy, I guess, can take several hours depending on how many there are to remove, and not all doctors are qualified to handle myomectomies, where I think most OB/GYNs do hysterectomies. And for years, it's been the normal course for fibroids.
I do feel that there's far more hysterectomies done in this country that perhaps should be done. If the patient, however, wants to have more babies, if the patient wants to preserve her uterus just because she wants to, with the surgical techniques available today and medical therapy available today, and there's several options available, there's no reason for that to happen.
Women need to be aware that there are other options to a hysterectomy for any kind of uterine problems. And if your doctor is unwilling to discuss other options, then look for a qualified doctor who will think the way you're thinking, and it never hurts to do your own research. She's a sweet little baby, and she wouldn't have been here. She wouldn't have had a life if I listened to the first 2 doctors.
If you'd like to access Dr. Ted's website, just copy down the internet address on your screen right there.
Well, the snow machine could crank up overnight. Don Webster's